Sometimes when you read in the literature, you're going to get this all-inclusive phrase, intellectual disability. So in the state of Kentucky, we separate the intellectual disability category into two categories, or two subcategories, mild mental disability and functional mental disability, which is what we're going to talk about in depth today. My name is Denny Paul May, and I'm one of the due process consultants from the co-ops in the state. And also with me presenting today is our compliance lead and compliance director, I should say, Brenda Combs. She's a special education director. She comes to us via Breathitt County, where she served for many, many years as director of special education. And before that, she wore different hats. She was even coach and a bus driver and everything in between. So I think she's a nurse. She has a lot of knowledge, a lot of practical experience. And we're going to bounce back and forth on this presentation. And we're going to talk about what MMD and FMD eligibility look like. But we're going to dive a little below the surface. We're going to try to look at some of the residual effects of these disabilities and what it is we need to be doing in terms of getting eligibility correct and making sure that we, once we do get it the way it needs to be, that we're providing the services that we need to be providing for these students. So our learning targets today, we're going to review intellectual disabilities information to grow your ability for accurate eligibility determination. And I'd like to say something about that before I go on. I was a director. My name's Denny Paul May. Again, I was a director at Pikeville Independent for several years. Before that, I worked in Pike County as a coordinator and as a teacher. I worked in the FMD classroom. I worked in the MMD classroom resource. I worked with LD students, preschool. Did a little bit of everything over the years, and I also coached like Brenda did. But one of the things that I was very adamant about, and one of the things that I think we really need to perk our ears up on, an unbelievable responsibility when we look at evaluation information to understand it and to get it right. When we're making a call that very first time about a student's life, we need to make sure that we're not inappropriately applying the assessment to the eligibility decision. And I'm a firm believer in that. I think we really, really need to wrap our heads in. A lot of what we're going to talk about today is going to be looking at below the surface what some of those sub-test scores mean on the WISC, or what a particular score might mean on the Vineland or the ABAS. And how in this particular category, how important it is for us not to jump to conclusions too soon, and how we're to take adaptive behavior very seriously. I think sometimes there's so much labor intensity to writing our programs, to writing our IEPs. There's so much labor intensity to understanding the documentation and understanding the terms. When we see the word survey or checklist, we kind of dismiss it a little bit. It kind of takes the heat off because it kind of implies that there's not some technical aspect to it. But the inverse is really true for this population of students, because we know that one of the purposes of the IEP is to support function, not just closing academic gaps, but functional behavior, adaptive behavior, maladaptive behavior. Now, when we talk about results from the Vineland and adaptive behavior, we're talking about not maladaptive behavior, we're talking about things like conceptual development. We're talking about things like communication, how we respond to concepts, and then also our daily living, and maybe with the younger ones, even some motor kinds of things. So we're going to talk about a lot of things. We're going to talk about information that is going to seem like it's kind of cut and dry, but I want to implore you to take very seriously your work around the Vineland, the parent surveys, make sure they know the instructions, make sure that we get right what we're getting back, because a big part of what we're talking about in education is making sure that these students can communicate, they can have meaningful relationships, they can get their needs and wants met, and they can take care of themselves. And those are big pieces of education. And if we're not doing that with real fidelity, and we're not doing that with some care, then we need to rethink what we're doing, in my opinion. And so we're going to get right into it. General characteristics of intellectual disabilities. We basically are looking at these two areas, IQ scores and adaptive functioning. So Brenda Combs is with us. Brenda, can you just kind of talk about these two areas a little bit? If we're looking through the lens of intellectual disability overall, what those things mean.
Okay, so when we're looking at those intellectual disabilities, what we're looking at is we're trying to determine if a child is functioning at a score of 55 IQ or below. Sometimes they may score 58 because we can take the plus or the -3. However, I caution that because a lot of times we place these children as FMD, and then they turn around and they get on alternate assessment. And of course, you know that if you're on alternate assessment, you do not get a regular high school diploma. This means that all the agencies, businesses out there that require a high school diploma, they cannot apply there because they would not get a job. So we need to look at those types of things. And then most of the time, your adaptive behavior, your IQ scores and your adaptive behavior will be around the same. The adaptive behavior, sometimes we let other teachers do those or an aide do those. And they haven't been fully trained on how to complete those. And we end up with maybe a child with a 57 IQ and they've got a 90 in an adaptive behavior. So you have to make sure that you are accurately filling out that adaptive behavior, because they shouldn't be that big of a discrepancy. And we have different types of adaptive behavior scales out there. It depends on what district that you're in. Most of them here use the Vineland in our KVAC area, but there's still a lot out there. But we just need to make sure that we are telling the parent, because there are some adaptive behaviors that the parent completes, that they put that in there as correctly as possible. And then the teacher also needs to do theirs as correctly as possible, because we want to have what's best for that student. We want to write goals for what's best for that student. And we need to know the specific areas that we need to function on for this particular student. Now, we also know that when you're looking for your MMD, your mild mentally disabled students, that we look at that score at 70 or 73. Again, one thing for sure is we can't take the 3 points from both the IQ score and the adaptive functioning. You can only use it on one of those. However, we use a triangulation of data too as well. So we have student work samples and those types of things, and then teacher observations. We have many things there that we can use to determine if it's close to FMD. We need to determine, with all the teachers around that has the student, is the child FMD, or should we try MMD first and see if the child is going to be working on that level. If not, we can have another meeting. However, we just need to make sure that we've got them in the right area. And we have found several students that are classified as FMD that are not. So that's another factor that we look at. Some of the schools that are in the CCEIS, we're finding, the eligibility among the FMD and the MMD are inflated. And we have to go in there and we have to check those students to make sure that they are either MMD, FMD, or something else. Sometimes we find that we have multiple, and they can be multiple. They can be FMD or MMD with a physical disability. You can't have an FMD and a OHI because of it. We look at this. If one teacher can teach all the skills and the goals that's in the IEP, it's only one area when you're looking at those areas. So the OHI can be taught within the classroom. The adaptive behavior, most of them are ADHD that we see. That kind of stuff can be handled in the classes, especially a classroom, and don't have to have a special teacher. Now, when you're looking at maybe visually impaired or hearing impaired or orthopedic impaired, those types of things, you have a different teacher. So they could be multiple. So we just need to make sure. I looked at one yesterday and they were multiple, but they had only marked MMD. So that's because a long time ago, we told them not to be doing those types of things, but they got confused with saying, you know, if one teacher could handle all that, then it's only one area. If it's more than one teacher, then it's going to be multiple areas and we'll have multiple disabilities. So we just need to make sure that we put the child in the right areas and not in the wrong. We had issues with students coming out as freshmen and sophomores in high school, and they're having to go back and do recovery for classes. So we have to make sure that if you see that child can work, do not put them on an alternate assessment. They can be an FMD student, but if you're on alternate assessment, you know, that means you're not going to get a regular high school diploma.
So what we're talking about here is IQ test, right? We're talking about those 5 areas that you get on the WISC 5 that really are sometimes maybe a little difficult to understand. Maybe you don't really know what the intention of the test is, what the test is measuring. And I can tell you that here at Cadet, Brenda has graciously gone into our Cadet coaching tool, which is a document that we put together that is actually a kind of guidance document in companion to the IEP guidance document that will take you through what the WISC means, what the implications of the WISC are in the classroom, what it looks like if a student has these deficiencies. And so we want to keep that in the backdrop of our mind as we think through this information. If we don't understand what visual spatial relationships mean and how that impacts our students' performance in the classroom, it's our job to kind of understand that, okay? And so we're trying to get that good word out, to give you the tools in the Cadet coaching tool to kind of look at through that WISC crosswalk. It'll talk about the tests that are given and what the student, it shows what the student would need in way of special assigned instruction and what the student might need supplementary extra services. And so, talking just kind of in the history of the intelligence quotient game, way back there, they used to just derive scores as a ratio between the respondent's mental age or developmental level and their chronological age. So here was the example that they gave. For example, a student who has a chronological age of 10 and has a mental age is 5, you would just multiply that and you would have an IQ of 50, okay? So the idea here is that the student, they're 10, but their achievement here on this intellectual test is that of a 5-year-old. So when you multiply the 2 together, you see what I'm saying? So they used that for several years, and then they started thinking, well, that's not matching up with the norms very well. We're getting scattered scores all over the charts. And so when you accompany that with the deficit of academic function, the student respondent will be labeled as having an intellectual disability. Same kinds of things we're doing today, but the difference has been that we have an onset of deviation IQ. And what that means is if you've got if you've got 100 people taking the test, 34% are going to fall to the left of 100, which would be to 85. And then 34% are going to go from 100 to 115, with the standard deviation from the mean being 15 points. Okay? And so when we're talking about intellectual disability, we're talking about 2 standard deviations from the mean. So we're not 15 points below, we're 30 points. So that correlates to a 7. Okay? So we started, this probably started coming along about in the late 80s, I want to think, or mid 80s. But before that, they were doing the other way, you know, the kind of the one that we were talking about before, where they were just doing that mental age versus that chronological age and multiplying it and getting the IQ. So the WISC measures intellectual ability of children from 6 to 16. We know that if you have a kid in preschool, either you're going to be given the Battelle measure, which is a developmental test that is kind of like the Vineland in some ways, but it asks a bunch of interview questions. But then there's also the WIPSI, which is a companion to the WISC that you can test 5 and 6 year old or 4 and 5 year olds with. And then you've got some other tests out there on the market. But by and large, we kind of adhere to the WISC 5. So here's what it looks like if you had this normal bell curve distribution of scores. 34% of the people here that take this test are going to fall in this range right here. So this is what the DSM-5 considers kind of the average range from 85 to 115, okay? And when you start moving over here, between 85 and 70, there's a cutoff line right here that the DSM speaks to, and that's 77.5, and that's 1.5 standard deviations below the mean. And that's how we look at developmental delay for students that maybe are in ages 3 to 8. We look at that developmental delay, and they get that 77.5, which is a standard deviation of 1.5 below the mean. The reason we use that, that's kind of the score that we look at to say that the student is significant and consistently below their same age peer. That's kind of like now it's not a hard and fast rule. We got to take adaptive behavior into account. We got to take behavioral observations into account, academic achievement into account, all kinds of other variables that play into an eligibility decision. So if you go on a little bit further, all right, and then you've got down here, so at this 70, when a kid has a 70, between 70 and 55, they're in the MMD range, right? And when they're at the 55 range down to about 40, that's the range that we start, or anything lower than that, we would look at as the FMD range. So from 70 on down, you can see much more people in this population. And as it gets out here to the edge, you have less people are represented. Does that make sense? Kind of the bell curve distribution. Same thing on the other end. If you're talking about somebody that's got a 160, that's a very low percentage of the population. That's why when we talk to you about, are you sure they need to be on alternate assessment? Are you sure you have that many kids that need to be on alternate assessment? Because the percentages based on the normal distribution are much lower, okay? And so, but then when you start looking at functional behavior, you got to think in terms of that. So you got 1 standard deviation here from 100 to 85. And then when you hit that 2 standard deviation mark, that's the population of students we're talking about today, okay? So elements of the category, clarify the relationship between intellectual functioning and adaptive behavior. Very, very important, okay? But we know by and large you must have intellectual functioning and adaptive behavior functioning that are kind of in keeping with one. But there may be more needs in functional behavior. And so we have to really be careful as we apply rules of eligibility to these students. Okay, we gotta really explore the adaptive behavior function and how that's impacted by IQ. You must have scores that are 2 or 3 standard deviations below the mean in both intellectual function and adaptive function in order to get in the intellectual disability category. Okay, so start looking at these really young kids. What are some things that might be early indicators of intellectual disability? Well, the research and the books and the podcasts, all the things that I've read says you really look at 2 things: language development and the ability to walk. If those things are not starting to develop pretty well by age 2, then you're probably thinking about possibility of student having intellectual disability. Now, if it's a parent of a student that's had their first child, it's probably going to be maybe not. They don't have anything to compare the developmental milestones to, so you may have to have a hard conversation. The other thing is, if it's the 3rd child in the line, they may say, well, the one before him spoke. So right? We do that as parents, right? And you might say, well, we carry the baby, you know, so they didn't learn to walk. So we're looking for reasons why they're not meeting these development milestones. They may, you know, the language may not be developed like you know, they may use pronouns incorrectly, or they may not pronounce their words exactly right. Now, there's some accounting for that as they grow, mature, and there's some differences. Can't say everybody's going to learn to say all the words by 2. You know what I'm saying? But still, that's a couple of markers that as early practitioners we look for in that preschool range. Can they talk to us? Can they walk? Okay, so motor functions working with intellect, right? And if they can, and then also, if you go into your reports, by and large, those students that have these type of problems have memory issues. All you have to do is spend a day in a resource classroom, and you spend another day, and you can see everything. It's a frustrating kind of thing to teach you sometimes, because you teach your tell-all, we know you do, and you come back. So we have to really develop strategies around retrieval of information from a blank slate as early as possible with this population. Because, and what I mean by that, retrieval of information from a blank slate, you've got to get them to bring information back to the table out of their brain. Maybe you have to scaffold it some, but you get them doing that consistently, and it makes a huge difference. So memory issues, big problem. Deficiencies in problem solving, and then you start to see the socialization issues. Now, when going back to our handy dandy little visual here, as these kids move further away from the mean, the more you start to see health sensory issues, vision, hearing, motor issues come into play. And what else comes into play? The inability to make good decisions. And so we start to see maladaptive behavior arise, or functional behavioral problems arise. So just think, the further you get away, you start to see it starts to make sense to you, right? It starts to really kind of make sense as to why this student is presenting this way. So what I want to do right now, I think I've covered. Adaptive skills are measured in 3 domains. Remember I said conceptual skills, this is literacy, self-direction, and concepts. It's this AAID. Okay, it's the Association for Intellectual Disabilities. Okay, and they do a lot of research and they do a lot of defining. But one of the things that they've come up with is these 3 areas are the areas for adaptive. Okay, and how important adaptive development is in regards to students that have intellectual disabilities. So we don't want to take the Vineland or the ABOS or the ABAS, however you say that, lightly. We want to do that with fidelity. We want to make sure the instructions for the people that are doing it, sometimes we'll hand it to the regular ed teacher. Do the Vineland for me, please. I've got 3 things to do right now. So you got to do this for me, right? And so we got to make sure that they've been trained, because the 210 might get a little misconstrued. We might get skewed scores. And so we want to do more than what that, we want to make sure that we've got good solid behavioral observation. We've got a good picture of the student, and we've got to guide those parents. So sometimes we have to really lean on those parents to tell us what the student can do. And so conceptual skills, social skills, look at all these different things that are measured. Social responsibility, self-esteem, gullibility, naivete, social problem solving, following rules, obeying laws, avoiding being victimized. And then those practical, personal things. Can they brush their teeth? Can they get themselves dressed? Can they make their own meals? Can they budget? All those things play in. And like I said, you start to see those things arise as the intellect goes toward the other end, right? So we got to make sure that we're taking both of those things into account. One's not any heavier than the other. And I'm not sure that I was trained that way when I started. So characteristics for students with deficiency and adaptive, conceptual issues, we kind of already gone over this, social issues and practical issues. Look, eating, mobility, toileting, dressing, meal preparation, housekeeping, taking medicine, budgeting, social media use and safety. And so it really comes back to the chronological age not being all that important, but the mental age and how you're applying those things, right? How you're what you're able to do with these types of things. And we need to, as IEP developers, be thinking about this as they get over that eligibility hump. What is it that we need to be doing with these students? The collection of conceptual, social, and practical skills that all people learn in order to function in their daily lives. So we've already kind of hit that hard. Now, right now, I want you to go, I want to transition to the paper, and I want you to find your FMD psychological. Should have an FMD psychological. The name on the FMD psychological is Jane Doe Smith. Jane Doe Smith. Okay. So what you're going to do is you're going to answer all those questions in that first category. Okay. You're going to look in there and it says read the psychological and determine eligibility. What information is needed to determine eligibility? Now you also have an eligibility form. And I want you just to put the information right on that eligibility form. Okay? So you got a little bit of work to do here. We're going to do a little work session now, and we'll be circling the room. We always say teach from your feet, not from your seat, right? And we also say walk around, look around, talk around. We can start seeing if there needs to be some scaffolding. If we need some help, we can ask questions, or if we're getting it, we can move on, right? So we're going to work through the eligibility form. Here's another added layer to your eligibility work that you're doing. On the back of this page is supporting evidence. You have to do triangulation of data. Now, I pulled from the guidance document. Autism guidance document is a really good document, but it has the pieces around academics, behavioral observation, kind of gives you some anecdotal or some bullet points to follow. So you can look at that and see if you need that to help when you get to the supported evidence piece. Okay? If it's not in the psychological, where do we get it from? When you think triangulation, you're thinking not just IQ score at the top of that page, but what's down on the two sides, right? Again, going back to what I said earlier, this is so high stakes. You see your academics, it's got those bullets in there, but then you have to jump over and kind of look for it. So you might jump over here to general intelligence, and we'll talk about general intelligence, but I really want you to focus on this whole piece about executive functioning and how that plays in. This is through the autism lens, but it's very applicable to the mild mental disability and the FMD disability lens. They could have, yes, it's very applicable. And then this whole idea about eligibility is on page 24. It talks you through eligibility, what it takes to be eligible. So I want you to say, with the information you have in front of you, is the student eligible or not in that range? It looks like they are, but have we done a good enough job? And there's your adaptive behavior piece. There's your eligibility piece. There's your social emotional piece. There's your executive functioning. I don't know why I keep saying effective, but it's got it broken down. Look here: response inhibition, emotional regulation, sustained attention, the ability to hold information in your working memory, and then do a task later. Those types of things. You see what I'm saying? So there's a lot of good information in here that will help you build your case, because you're building a case. In that supporting evidence, you're saying, okay, we know we got up here at the top of the triangle, we've got the IQ score we need. But do we have the anecdotal information down here through the academic piece? What's it look like? What's the behavioral observations look like? What does that all look like? And then we come over here to the other side and we've got behavioral observations, right? We might have behavioral observations on the general intelligence test itself. The psychologist should be giving you a little bit of behavioral observation. You see what I'm saying? So is all of that stuff adding up? Yes. And even if the kid's score is 73, and we're going to talk about that in a minute, but if we're on that borderline, do we put them in or not? Do we put them in or not? So we're asking ourselves, if we've got strong evidence in those other areas, behavioral observation, academic achievement, functional behavior, Vineland, all those pieces go into the overall building that case. But you really should really be going into detail. And especially you should be going into detail if it is a time when the student is first going into programs. The initials are really important. But understanding the executive function, understanding the adaptive behavior can color what you do for that student programmatically. Okay, so what I'm saying to you, you know that they best learn a certain way, or you know they've got a certain pitfall intellectually, if they've got executive function issues, they've got communication issues, if they've got socialization issues. How many times have you seen this kid who doesn't understand social cues? They have a mild mental disability. They don't know how to disengage from a conversation. They don't know to follow school rules. They don't know how to take care of money. They don't, you see what I'm saying? So all of that lends itself. And then if you look at the FMD population, and we're trying to decide, are they just an FMD student, or are they actually going to be on alternate assessment? Can they hold a job? What are their needs significant in all those areas? So we have to look at the executive functioning. We got to look at how they can actually do communication, socialization, daily living, and then really think, in terms of that. Because in some places, they don't use the discrepancy models much anymore, and they let RTI do that. And so you'll get a much greater variance in the in intellectual disability as opposed to specific disability, specific learning disability. So big red flag if they're across the board and they're LD and everything. What you're doing is you're looking at the autism guidance document. It's pages 18 through 24. And I'd really like you to take some time and read through that. I want you to think about, yeah, I've got the IQ score, and this is what the IQ tells us. Working memory's low. This is what it means. We could go through the crosswalk, and we can get the information we need there. But we're really just trying to build a case. And then down there in those other two pieces of the triangle, we're looking at academic achievement, we're looking at functional achievement, and we're looking at behavioral observation as our four real big pieces. And so some of that information is going to be in the psychological. Some of it you may have to look at other documents. If they've not done a good job with the psychological, you may have to pull all those pieces and integrate all that together. Now, that's the real purpose of integrating all that information into one nice, neat document. You should be able to pull that thing up and answer all these questions. Sometimes you can't. Sometimes you have to repiece it together.
Yeah.
Okay, so again, as we work through the supporting evidence piece, we're building a case for eligibility. So we got to have some strong evidence. Remember, I talked about proposal, evidence, decision. This is where we're proposing the eligibility here, right? We got to have strong evidence. We can't just regurgitate test scores. We got to really know how this child functions. We got to have some behavioral observation support. We've got to have some academic evidence. some work samples. We got to have some functional scores, okay? Can't just be the IQ that we lean on. And we really want to be good at determining eligibility. We have to see function as equal to IQ, adaptive function equal to IQ in the determination. We need to know, do you have the scores that you need for eligibility? What scores do you need for eligibility? And then what is that triangulated data? What are they talking about with triangulated data? We've kind of given you some scaffolds. We've given you the autism guidance document that has several good reminders of things that you can list and look for information in. Remember, we're trying to propose eligibility. We are trying to provide the evidence for eligibility. And then we're also going to make a decision at the end. Yes, is this student eligible? No, is this student not eligible? Got the on the screen visual of the distribution of scores through the bell curve, and that helps guide your discussion as well.
When I do this stuff, I look at it as this is my child. If I'm a parent and I'm reading this information, okay, full scale IQ 55, what does that mean?
What does it mean?
So I try to put it in terms as me being the parent and
If I was
make
sitting
it-
on the other side of the table,
yes,
Showing
and
and explaining.
So-
that.
understand it
having-
on their level.
having that empathy,
Yes,
and think about how technical the jargon is for us as education professionals. And so I say this all the time to all of our, just about every training that I ever do. I say, you know, it's so important to know the language. As a professional educator, we've got to understand what verbal comprehension means. We've got to understand what adaptive and executive functioning mean. And that's why I want you to work through this, because this is looking through a different lens rather than just regurgitating what the already obvious is. We know what the report says, but what does the report, what's the why behind the report? What's the support for the decision? And to me, it's one of the most vital things we do as educational professionals, especially if it's an initial referral. While we're thinking about this, we're looking through the lens of FMD eligibility. So we have to have particular scores, don't we? Because when you're filling out that eligibility form, you've got to answer all those questions as yes, right? And so there's not a lot of leeway. It says 2 standard deviations on the MMD one, and then it says 3 standard deviations. So using the IQ chart that we've got up here and the bell curve, we know we have to be in that 55 or below range on both IQ and adaptive. Okay, and that's an overall score. Okay, so you're going to have subtest scores that are going to be higher or lower than that, maybe. There's going to be some fluctuation. And then when you're writing your present levels and you're thinking about strengths in general intelligence, it's going to be those higher scores. Okay, and that's going to speak to how the student best learns. So that's going to help us write our program. All right, so are you guys ready? Do you all as a group want to go up and talk about what you found? Come up to the Jamboard, put your sticky note up there. Oh, you want to just talk about it? Just take the paper and walk. Yeah, just go up there and talk about it. Go ahead.
So you want like a supporting documentation?
I want to know everything that you all came up with. Just talk us through that.
So on the 1A question about the cognitive function, if it's a 3 standard deviation, we put yes.
Okay, so the score had to be what?
It was 55.
Exactly 50.
Exactly 55.
Exactly 50. So it met that, right? It met that.
But the adaptive behavior with the 3 standard was a no because her adaptive was a 62.
Okay.
So it was much higher than the 3.
Now, let me point out something to you. If it's an initial, we need it to be tight. If it's a reevaluation, there is an allowance for the score to go up, because the thinking is if you've had the support, you don't have to meet it that second time around. So that's a little bit of a, we're hoping to see that. That's why it's so important to address function. Okay, we're expected to see these kids become more independent, be able to communicate better, be able to have social relationships that are meaningful. get their wants and needs met and that kind of thing. So we do allow on a reeval for that to be a little higher, okay? But not a lot higher, but a little higher, okay?
So when you look at that, it's a 62. If you take the 3 points, it's going to be a 59. This is the 4th time this child has been evaluated. So, you know, you have to,
Expect it, can't you?
you should expect that.
Hopefully you see it if you're doing anything with the child at all, right? Go ahead, I'm sorry, I didn't mean
The
to read.
severe stuff, we put a yes. The
Okay.
overall academic performance,
So what are you looking at there?
so there's where you would look. You can look at all the other test scores.
The other test scores, academic test, yes, because you're looking at academic
Look at the
overall.
math
Yes.
part.
Now, let me ask you a question, put you on the spot here. What if one of those scores is 68? Do you keep them out of the program because they got a 68 on?
No, because then
Math.
you can keep looking at the rest of it, because those underlining tests under the math, and if those scores are still low, even though we got a 68, you can look at those.
So it's an overall look, right? But now if all those scores were in the 70s,
Then
we'd have a
you
problem,
could-
wouldn't we?
request-
We could say maybe the test wasn't given correctly, or maybe that's why the adaptive behavior is a little higher. So we start being an investigator, right? But an overall, we'd say, if they have a 70, if that 70 IQ is really true, or that 55 is really true, they're going to have reading, math, and writing. Remember back through the concepts? Adaptive behavior plus intellect are going to lead to those academic difficulties. Okay, so what's the next one on there?
The manifestation is typically during the development period when it is.
Okay, so let me ask you this. You guys have been doing this for a while. What's the developmental period in Kentucky? Anybody know?
Until their present age.
Okay, their present age, fair. Okay, but it's up to age 18, right? Up to age 18. So it has to manifest itself in that range. So you can't come back at 19 and say, oh, well, you have, it's, so that's kind of a question that, yes, it's already emerged. Okay, it's not going to be something that's incident driven. See what I'm saying? Like a traumatic brain injury kind of thing. That's why that's there. Okay.
And then evaluation information confirms that in an adverse effect on educational performance is pretty good.
Okay.
And then education information confirms a lack of instruction in reading and math. It's not a determination factor in the eligibility decision for the year.
So what would you look at there? If you were putting supporting evidence with that, if you have they had the proper experiences? Have they been in school consistently? Now, if a kid's missed 40 days in first and second, you're trying to make them, you might have a problem, right? That's an exclusionary factor. Now, those are much more developed in the LD range or in the LD eligibility, but it's still, you got to have the proper experiences in reading and math. It's on every eligibility form, right? Got to have the proper experiences. So have they had the core instruction? Have they been through the tiers? Do we have the information we need to accept a referral? You see what I'm saying? All right.
And then evaluation information confirms limited English proficiency is not determined factor in eligibility decision or previous.
Okay, so if English is the second language, we got to give them enough time to be immersed in the culture. We don't want to find within the first 6 months that they're in school with us. If they come out of a non-traditional home, like they've been come from another country, have different language, we've got to make sure that it's not being from another country that's causing the barrier, that it's actually a mental disability. Okay, good. All right, I'll flip her over. Here's the big piece. Here's the one we were working so hard on.
We put Jane Doe can retain information she has learned in a repeated fashion.
Okay.
And socially, I went to the behavior observation, it said socially, she seemed highly cooperative and pleasant during the activity, whatever they were doing, but did not interact adequately during the course of the assessment and has difficulty understanding more complex procedures such as repeating numbers from smaller to larger.
Perfect. You guys have things to add to the supporting evidence piece? No? Okay, so let's think about this. If we do a really good job with our supporting evidence, if we look at what the strengths are if we look at what the needs are, we look at the scores. Now, we're thinking triangulation of data. Up at the top of the peak is the IQ score. Over here to the left is the academic achievement and the functional behavioral scores. And down here is your behavioral observations. Those are the three pieces of triangulation. But have we identified how the student best learns? Have we identified what the IQ score says their low and high marks are, their strengths in intellect are, their deficiencies are? What are their strengths in academics? If we do a good job with this, we've got our general intelligence piece written, and we've got a lot of our academic piece written, and a lot of our social emotional piece written. So that there should be some similarities to the evidence here as to what you're putting in present level. You see what I'm saying? So there's connections there, right? That makes sense. And remember, we're putting enough evidence in there that we're building the case for this student that might be in the borderline. Okay? All right. So, we good? All right. Thank you all. So, on this slide right here, I want you to think through eligibility. Now, in Kentucky, it's not enough just to have a diagnosis of an eligibility. You have to also have an adverse effect. So when you work through this information academically, executive functioning, adaptive functioning, you can show that adverse effect. And you can also say that this student, by showing adverse effect, is significantly and consistently below their same age peers. And then they're going to need specially designed instruction in order to benefit and make progress in the general curriculum. That's the language you need to use. Okay, in your conference summary, when you're documenting that the student's eligible, you've got to go through these three prongs. Yes, they met the eligibility form. Yes, we did the triangulation of data. And yes, there's an adverse effect that is readily apparent. And yes, the student needs specially designed instruction. So if you're going on the slides, you can see we kind of put some stuff over here, just kind of capture just a few things. But I think that autism guidance document captures much more.
It does.
In detail. It gives you a lot to go on. So we could do this MMD. We know that MMD level, what differs there is it's 2 standard deviations, which is a score of 70, and a score of 70 on the adaptive behavior, right? Those are the key pieces that you're looking at, but then you're also going to do the same thing on the supporting evidence. You're going to run it right through that. What does the academic performance say? What does the adaptive say? What does the behavioral observations tell us? What does the IQ breakdown tell us? What are the strengths? What are the needs? How does the student best learn? What's the profile look like? What's the mode of learning for the student? Are they an auditory learner? Are they a visual learner? What is it that really talks to this kid? And then there's an eligibility document, and it has some information on it. The ARC documented evidence that shows the cognitive function is 2 standard, and you go through that same eligibility form again. And here again, you see we're in this range, 70, no lower than 50, no more than 3 standard deviations. There are only 2 standard deviations this time in MMD, right? 2 standard deviations, but notice we say that we expect the adaptive behavior to increase over time. So you can still find them eligible that way. Developmental period is before age 18 in Kentucky. So here's the ARC documented the review and analysis of evaluation information, confirming the deficits have an adverse effect on educational performance to the extent specially designed instruction is needed. It showed how the student's performance is consistently below, described the unique differences of the student that warrant specially designed instruction, and draws upon information from a variety of sources. The key here is a variety of sources building your case for eligibility.
So since we had a no on that paper and then looking at these other reports, would they be FMD, the first one that we were talking about? We had a no here. Even though I know that she's older and we said that we could do that.
55, but here's a 66.
Well, you want to, now your score that you're looking at is your full scale score and your composite score on your Vineland. So yes, she would be FMD.
Or you could play the devil's advocate,
You could play the devil's advocate.
Yeah.
because if these scores are like this, it could be a teaching, like we need different strategies, we need different interventions for this
Yes.
student. Because as you say, when you read back here when you read the back part of that, it gave us some information about, about testing. It actually, told us about her testing. So you had the child in class, you probably understand the child. It's been this fourth time this child's been reevaluated. And we do know that her verbal comprehension index is 66. That's pretty significant, higher than what you would think. And you look at those areas underneath that and you see that they are low, but they're not low like you've got in that digital span there. Some of them are pretty high. So you look at that child, because if you was to put that child in there, then you want to look at and see, what can I do differently as MMD with strategies and interventions and those types of things to get her back to where she needs to be.
That's one that's on the
It's on the border.
That's on the border.
That's
So,
why we
and
use
it's the ARC decision. That's the reason why you have to have all your cards on the table.
So her other scores though, they're all higher than 55. And, or the 58,
Mhm.
like on her Vineland, all of them are high, like 68.
So you would question, what's the most appropriate placement?
Yeah,
And that's why it's so important. And the reason we use this one was for you to see how important it is to build that supporting
Go either way.
evidence for whatever way you feel like it needs to go. When you're on the border, you have
like
to,
I would think.
and
she-
adaptive functioning is much more important than that one IQ score.
Right, because because
Even though when you look at the academics, like I said, you have to have, this person might need more small group, more individual, those types of things. And would that probably change these scores here? Probably,
right.
if she gets what she needs.
And would this student be one of those that would be hard to find and to justify alternate assessment?
Yeah, because she could almost do the regular,
So that old adage that if you're FMD, you're on alternate automatically
no,
doesn't hold water, right? It doesn't hold water. So that's why we say we've got to be real intentional. We got to think about function. We got to think about the purposes of the IEP. What's the purposes? Academic, function, and transition.
I mean, if she's 17 and taking her out of FMD,
That's another issue, right?
yeah,
That's
so
another.
she's lost 2 years of high school at that point.
At that
Don't
point,
have to
it might be too late, right?
I
Might
mean,
be too late for,
Well, I mean,
to be able to
she was not
have the
allowed to
credits.
get the credits.
yeah.
Yes.
she's been-
Well, she's got all the way till she's 21. And I've seen this happen already in a school district, and they're on recovery. So,
But how did?
yeah, they made a mistake, but it wasn't an intentional mistake.
Right.
They thought,
But then once
It
they
goes
got
back.
into high school and she was there a year or two, it was like, oh, wow. We think we might have made a mistake. And that most of these were on alternate assessment. So guess what?
so how would she do it if she's been on alternate assessment this whole time and then
She would,
test, and then she tests MMD?
number one, she probably should have never been on
Never.
alternate assessment based on
Yeah.
the
Yeah,
But
data
I mean,
that
if
we
they
have.
just say they put it on the alternate assessment, how does that work if they're?
Then you'll have your
that far
ARC meeting and you would have to talk to the parent, discuss all this with the parent, tell them that they would have the opportunity to recover those credits through credit recovery. It will take her longer than 4 years to graduate, but she would get her degree prior to being
But she
21
could
years of
still
age.
Switch over if she tested like MMD.
Yes.
She could switch over to the regular state testing.
I didn't think
Still
it
read the
was-
high school.
Let's go on here. Now, proficiency was not a determinant factor. What's the evidence for that? We're answering that question. Social developmental history, summary of past and present support and comfort summary. Okay. So you're looking in that area. Of course, we're on the MMD now, right? So we're looking at social developmental history to answer this question. It will show up if they've been at any time limited English proficiency, right?
Yeah.
Of course, the parent was provided a copy of the evaluation report and documentation of the eligibility determination. That's due process of law. If the parent did not attend the meeting, the ARC documented a copy of the evaluation report and documentation of eligibility was sent home and what date it was sent home on, right? So very, very important there. And then the other pieces, ARC membership. It says required all members, it has parent listed under there, but in all legal reality, the three that have to be there, special, regular, LEA representative. Parent has to be invited. And so that's a little bit of a form issue. Yes, yes. One thing here, real quick. Let's get to the very end of this. This standard error of measurement, this whole thing about standard error of measurement. It is plus or minus 3 in most cases, but you need to talk to your psychologist because it's based on age. Okay, it don't always come out perfectly to 3 points, always. So you have to be careful, especially on an initial referral. You got to make sure on standard error measurement.
Sometimes it's less.
Yeah, so this information on this slide right here will tell you. And if you have questions about the use of standard error measurement for eligibility, please reach out to us. Again, my name is Denny Paul May. Brenda Combs, thank you for being here.